Did you know that a lot of incredible community health work is happening right here in Missouri? At the heart of this effort are community health workers, or CHWs, who play a vital role in Missouri's public health. CHWs are trusted community health professionals who often reflect the community in which they serve. They work in and beyond healthcare, building knowledge and skills in their communities. Here's what you should know about CHW's work. It's cost-effective and has a positive return on investment, or ROI. While return on investment can vary, a recent study found that a CHW program serving Medicaid patients yielded a 247% annual ROI. It has been instrumental in improving health outcomes across numerous conditions, from high blood pressure and diabetes to infant mortality and increasing preventive care. It also improves social determinants of health, like housing, employment, and food access. It improves health equity by increasing access to health and social care for vulnerable and underserved communities. And CHW work isn't limited to the healthcare system. You'll find CHWs working across various systems to address the health and social needs of community members. To keep doing this life-changing work, the CHW workforce needs to address 3 key areas to ensure their sustainability: personal health and wellness, sustainability and effectiveness of their service delivery programs, and education, training, and career opportunities. To support these 3 areas, the CHW workforce needs access to diverse funding sources that holistically fund their work and are more sustainable than traditional grant funding. Some options include publicly funded reimbursements for health and social care, provided through programs like Medicare and Medicaid. These reimbursements often only cover a fraction of a CHW's work because they typically only pay for time spent doing direct, face-to-face patient care. This is an opportunity for innovation. Private contracts for CHW services. Contracted funding can be fee-for-service or based off a variety of population health and value-based care models. While this approach has the potential to cover the full scope of a CHW's work, it requires negotiating individual contracts with health insurance payers or other private businesses. Existing organizational budgets. By integrating CHW services into budgets for standard service delivery, organizations can reduce the need for CHW-specific funding. This approach often requires multiple budget cycles to be implemented. However, it can greatly simplify funding for CHW programs. Ultimately, most CHW programs will need a mix of funding sources, such as grants and service reimbursements, to be sustainable. This mix of funding is known as braided funding, and it's needed to ensure that CHW programs can provide holistic services and achieve financial sustainability. So, what can you do? Decision makers can champion policies and funding opportunities that provide holistic funding to CHW programs. For example, improving Medicaid and Medicare policies for CHW reimbursements. CHW employers can leverage their internal resources to holistically fund and support their CHW programs while advocating for policies that make sustainability easier. And all CHW allies can dive deeper into the St. Louis region's CHW workforce convening, the HEAL Partnership. Get engaged at stlchwcoalition.org/heal. Learn more about CHW workforce sustainability and discover how you can make a difference at stlchwcoalition.org or stlewisihn.org.